Joe Dibber is the Director of Digital Transformation at Baystate Health. He's on a mission to help organizations understand the potential a changing time will unlock, transforming the way services are delivered and achieve compelling win-win value for the consumers of services and of the organizations delivering the care. Joe's experience includes 22 years of healthcare tech leadership, including CIO at Berkshire Health, CIO at Baystate Healthcare, and the Executive Vice President Leader for a transformational digital therapeutic solution provider. In his current role as the Director of Digital Transformation for Baystate Health, Joe leads the process of driving innovation in support of Baystate's growth and outcomes strategy. Baystate is a $3.5 billion integrated health system in Western Massachusetts, serving over 800,000 patients across 5 hospitals, 90 clinics, an accountable care organization, and the Health New England Insurance Company. In addition to digital transformation leadership role within Baystate Health, Joe provides innovation strategy leadership within TechSpring, Baystate's innovation center, partnering with numerous innovative healthcare solutions, providing product insights, experimenting within the Baystate Living Lab, and solving passionate problems for healthcare. Joe, welcome to the show.
Great, thanks, Alan. Thanks for having me. Hey,
welcome,
Josh.
Joe.
Thanks. Amazing. So Joe, actually, a good jumping point, throughout your career, you've had an immense focus on optimizing healthcare workflows from the back-end EHR perspectives, informatics system architecture, and then more recently from digital transformation for health systems using technologies like digital patient engagement and SeamlessMD at Baystate. It's no question that COVID-19 has certainly accelerated the digital transformation in healthcare. But I think what's unique is you were actually leading that charge pre-COVID. And so really where I wanted to start the conversation is, where does your motivation for digital transformation come from?
Yeah, a great question. And it comes from a couple of different avenues. It's these experiences over the years of how do you leverage this investment of a medical record system, pick your vendor, pick your health system, and how do you get the most out of it, and how do you engage the patients? There's always been this missing piece along the journey. If I go way back to the early 2000s to where we are today, and the one thing I constantly hear is from physicians about their engagement with an EMR. I hear from patients about how do I get access to my medical information, and then you have a personal experience hit you like a ton of bricks. And that personal experience was when I was traveling quite a bit for a vendor company. I at one point I felt like I got hit by a train. My own health was impacted. And so I went to my doctor. I said, something's off. And he goes, of course it is, because you gained 40 pounds and your A1C is through the roof. I'm diagnosing you as a type 2 diabetic. At the same time, I was working for a diabetes type company that engaged patients in that care. And we had health coaches in that company. So I grabbed the coattails of a health coach. I used that digital app, and my A1Cs came down, my sugars came down, my stress came down, because I was able to see the cause and effect relationship. And I'm like, voila, there's something here. So that drove my own personal motivation to kind of then pivot into the digital health app space. And how can we leverage these apps to improve the overall experience for our providers and also for our patients? And so far so good, knock on wood. But your own personal journey that kind of influences you along the way, and go from there. So,
yeah, that's amazing, Joe. And I'm curious, I guess that must have been some time before you were at Baystate, and then
yep.
were part of launching TechSpring. So I guess when you started doing TechSpring at Baystate, to kind of bridge the gap between technology innovators and frontline providers, can you tell us maybe a bit about how that started, and sort of the gaps you see that filling in care delivery?
Yeah, for me, I've been with Baystate and TechSpring now for a little bit over 3.5 years. So when I was introduced to Christian Leger, who is the Executive Director and VP of Innovation for Baystate, I became very intrigued and inspired by their model. And really, it's closing that last mile of technology innovation. If you look at Baystate, that $3.5 billion health system, the 12,000 or so employees that we call our living lab, everybody in our organization leans into how do we improve care. So it became a natural fit along that journey. And when I began to look at the portfolio of projects that TechSpring collaborated with different vendors, including Seamless, I became even more intrigued. So, okay, how do we take this to the next level? And that's kind of why I joined TechSpring. So, okay, take that CIO experience and take that EMR experience and that personal journey, and then how do we look at different ways to kind of innovate around the edges of a major Cerner implementation or Cerner investment. And then how does that kind of all dovetail into our strategy longer term? And it made quite a lot of sense. The types of companies, you'll see the different logos on the TechSpring website, small startups to national global companies that want to innovate and accelerate their products and services along the way. And the one thing that we always look at is when we're innovating is what is that passionate problem we're trying to solve for Baystate, and how do we tie that to the projects or the programs that we're working on to deliver that value. And we're always looking at that passion problem in Baystate, because a $3.5 billion, we're a mid-sized market. That's basically healthcare across the US. We're not the big HCAs or the Kaisers or the Cleveland Clinics, but with the majority of healthcare that you see. So if we're solving a problem here in Western Mass, most likely the same problem that can be solved, somewhere else in the country. So it's quite exciting.
And Joe, I'm curious. I love the idea that you're trying to surface some of these internal problems, and so that way you're almost like you're not looking. It's not like you have a hammer and you're looking for nails. You're actually trying to look for problems, and you're looking for the holes, I guess, to find nails for. But how does that work with TechSpring and Baystate? Like, how are you surfacing these problem areas from the frontline staff exactly?
Relationships, really. It's, starting off when I first joined TechSpring is going out to meet with the senior executives and learning what their needs are for their part of the organization. And then going down a few layers to different management and just listening. It's this, this principle I have, it goes back to Stephen Covey. It's like, first seek to understand, then be understood. So that's kind of what I apply. Is like, what are the problems you're trying to solve daily? What are the issues? What are the concerns, and how do we map this together? And then I kind of look at the digital landscape and say, okay, here's a solution provider, here's a partner we have under the hood already in play to then can be leveraged. Similar to like SeamlessMD. Now we're looking at expanding ERAS, and we're talking about expanding the use of SeamlessMD in different service lines. It's just a natural fit, natural direction to go. So that's kind of the process we go through. And pre-COVID, we had a monthly, kind of meet up at TechSpring. We have a beautiful office down in Springfield. And we have about 100, 120 people show up, and we just have general conversation, kind of cocktail chat, and kind of understand their pain points and figure, okay, what can we do to help?
Yeah, I love that, Joe. I mean, I remember like Seamless, we actually were at one of your TechSpring events in the pre-COVID world, and phenomenal innovation and culture built around innovation at Baystate. I'm kind of curious, having been at different size organizations in your career, something like a TechSpring, this innovation hub in a hospital or health system setting. Do you think that any healthcare organization of any size can be set up to successfully implement and support this type of innovation center? Or do you feel that there has to be certain foundational pieces in place or readiness or size for it to be successful? I'd love to get your take on that.
Yeah, great question, because there are two things that really come into play there. One is your culture ready to leverage innovation? Is there an appreciation of starting the journey and thinking differently across, if you will? We've talked to, myself and a couple of colleagues have talked to different innovation centers across the country, and some are heavily invested, $5-7 million to go innovate. But truly, what value are they delivering to the front lines? What value are they bringing back to the health system? Or is it more tied to an incubation for an investment fund, which we are not, right? So what is the priority of that innovation hub? And we've been contacted by a number of health systems that want to leverage our model to be able to build out that culture. So we do that with health systems. If they contact us, we want to share how we do things, and we're open to sharing. And we're actually building a TechSpring network. One of our partners, early partners, is LifeBridge Health out of Baltimore, Maryland. And now we're having conversations with a couple of the different health systems, and actually a couple of different VCs who have said, okay, how can we leverage your innovation to help us de-risk our portfolio and de-risk our investment? So interesting conversations along the way. But it's awesome. The number one thing is a culture. If your culture's not ready for it, don't even start. That's your first question. That's your first kind of step, if you will. So,
yeah, that's excellent. And I think talking about the culture of TechSpring is very important. TechSpring is super unique for a variety of reasons, like you just outlined. But one part of that culture that is certainly what's made TechSpring so effective and really caught my eye is how there's this multidisciplinary approach to innovation. So as an example, you're inviting frontline clinicians to the table to both develop and deploy all these new technologies. Could you share a little bit more about why it's important in your eyes to have such a diverse group of people when evaluating and developing health tech?
Yeah, it's a great question. You know, one of the things that within healthcare, things are so tied together as far as a patient journey through the health system. So the more front end insights you have, and that's kind of that is what we call programs, is the insights review. If you kind of look at how that patient or what the issue is, what that journey is through the health system, grab a key stakeholder along that journey so you have great insight into what problem you're trying to solve, because everybody's coming to the problem attacking it at a different viewpoint, right? And then how do you kind of go through that process? A great example of that is tying in the clinical educators into a program that's going to be on the frontline education. How do the clinical educators see tackle on this program? What do they need to do if the program is successful to embed it in their education program to teach the new folks that are coming on? Tying in equality folks to make sure that the outcomes that you're expecting to achieve are measurable, and tying in the finance folks. So if you say you're going to save 1.7, 1.8, or $3 million or $6 million, that they put their thumbprint on it, and we're all following the same journey down the road. And that's really important, especially in programs like we're doing now with RPM programs that, you know, Medicare reimburses for. We're having some success in another RPM program in the OB space. And now our payer, Health New England, is actually coming to the table and saying, hey, you guys are having great success there. Let us go ahead and reimburse and pay for members on that same program. They never did that before. So it's quite interesting how that's starting that conversation. I'm so grateful to the leaders of HME that want to come to the table and have those conversations. Mm-hmm. So it also opens up the umbrella a bit to further digest that problem and also come with more concrete solutions at the end of the
day. And I guess, Joe, like to your point earlier, having a culture that's ready for innovation really helps with this process of engaging all the stakeholders, because if the culture is there, you're not having to drag people into the room. They're asking to be in the room. They're asking to be part of the conversation. It sounds like at Baystate, that innovation culture is there, so you're not having to drag people into that conference room.
Right, exactly. And then sometimes you have you know what problem they're trying to solve. You know what solution to bring to the table, but they're quite not ready for it yet as a department, as a group. And you kind of get that, okay, well, let's not push rope uphill. Let's not push tech just for tech's sake. That readiness level and that understanding of that change management awareness. So we back off, we may pivot to another area that's having the same problem or same opportunity, and then come back around. So we try not to waste time and energy. It's that kind of approach. If I put my old vendor hat on and you think of like the sales approach, it's like, are they the right client for the success of whatever program you're going to deliver? If the answer is yes, then let's go ahead and engage. If not, time is not right. Time to shift and go forward. 6 months down the road, 8 months, 10 months, they're going to hear about the results and the impact. And then they're going to go, okay, now we're ready. And you just make it happen at that point.
That's like very astute. I think like the emotional intelligence to just even be aware of, okay, the department's not ready yet. That obviously takes a type of person, a certain person, to be able to identify that. And I think it's neat, Joe, when, you know, we were doing some of the research for this podcast, I came across, you know, many of your colleagues have actually shared their admiration for your leadership, your focus, and your deep knowledge, both strategically and operationally. I think when it comes to implementing technologies, you know, ensuring that your staff and providers are engaged the entire step of the way and really have some skin in the game and feel a sense of ownership is really important. Why, in your eyes, is that super important to engage everybody in the decision-making process and ensure that they have this sense of ownership when implementing technology?
Great question. This is just, I get so passionate about this particular type of question because it goes way back when I was a young man and I knew nothing. I was working for a large EMR vendor, and I was hired because I knew how to teach adults. I knew nothing about healthcare, anything else of that nature. And I was teaching the application. It was West Florida Regional Medical Center in Pensacola, Florida. It was 96, maybe 95. And a room full of clinical leaders, and somebody raised their hand and said, "You're doing really nice, but do you really understand what we do as an operation, as a business?"
Nope.
No clue. She spent 4 hours with me the next day and taught me everything I needed to know about her operation to then leverage the technology, right? So just taking that experience and saying, okay, I'll never get into a situation where I don't understand the problems that we're trying to solve, or what the change management is, or whatever the case might be. And that's, I think, some of those quotes that you mentioned come from my friends over at Berkshire Health Systems from years ago. And I'm so grateful that they put that on LinkedIn and different stories. But those are the things. It's like you take that educational mindset and you sit down and say, okay, how do I understand what you're trying to achieve in your operation? And how do I not only I don't want to stick technology to overlay into a process, but let's figure out that process where we can improve and then bring in the technology. And what I found over the years is that the appreciation of that approach has been so grateful on the other side, and that's a way to build those trustful relationships. Because I also am a firm believer, especially in healthcare INT, you need to have those trustful relationships, because sometimes the stuff doesn't work right. And you have to have the trust that you can go and fix it, and give you time to fix it. And then you have clinical leaders on the other side partner with you to get through those challenging times, right? So it becomes a win-win relationship at the end of the day. But yeah, it goes way back to when I was a young guy and I knew nothing. So
I love that talk, the discussion on having the frontline staff feel a sense of ownership. It reminds me, even with Seamless, when we ask providers afterwards, what was the biggest benefit of going through this experience with us? I mean, usually it is things around, getting better outcomes and improving patient satisfaction, et cetera. But quite a few times we hear from clinicians that a big benefit was forcing them to get in the room to understand what protocols they were educating patients on, finding out that providers were saying different things. And we basically forced that discussion of, well, what is the one message you want every patient to have? And how can we use Seamless to deliver that consistent message every day to the patient? And just getting people to talk who otherwise were just not talking, got them feeling,
It's so powerful. It's so powerful, standardizing that process, getting them in the same room, making those decisions, and having that frontline ownership of the program. It becomes part of their service delivery and becomes part of core of who they are and how they do things, right? And you can't, it's one of those, things you can't pull out of their hands, right? It becomes sticky. And when you see that impact and having those leaders own that program and going, yes, I'm putting my next couple of years in the budget and making sure I get this, funded or whatever the case might be. It's quite exciting. And that frontline ownership, there's another, belief I have is that, 80% of what we're doing, is not technical. 20% is, right? But that 20% ties into that operational workflow so tightly to make the outcomes what they are. So pretty cool.
Yeah, that's fantastic. I'm curious if that ever backfires, if it's ever like, oh, this is such an archaic system now and we can't progress, or if that's not really come up.
Yeah, no, I've had not necessarily Baystate, but another situation where it backfired in a very positive way. We're having such good outcomes in the hypertension clinic that we're reducing office visits by 33%, impacting the fee for service model. So that's a different type of backfire, right? So that's so those things have happened. And then others in which you may have a leadership change, which has, that leader may have their own kind of approach to it, which just becomes a change management thing. But sometimes that creates a little bit of a hiccup along the way. So, but yeah.
Yeah, no, that's great. So I do want to chat just briefly about SeamlessMD. We've been partnered with Baystate and your teams for a number of years now. And so I'm curious, this is still a relatively new category of technology, or a relatively new type of technology. So how would you describe SeamlessMD to someone new?
I describe it as patient and clinical coordinate or collaboration, because the patient is not only the patient, but also, their loved one, right? So that it can be connected to the app. So it's that care team model, making sure that patient has a successful journey pre to intro to post. And it's just so important to have that touch, if you will, that check-in approach, and the ability for operational improvements to reduce phone call visits, but more importantly, looking at the outcomes of reduced readmission rates compared to not using the technology. Also the reduction in SNF transfers. So the quality of care is certainly improved along the way. But I would kind of summarize it as that patient care team collaboration platform. Makes a lot of sense. Our clinical teams love it. Our quality folks are seeing the outcomes. Our patient engagement levels. Josh, I haven't seen the latest. It's like 86%, 87% of engagement. And the only challenge we really have is that some patients just don't have access to technology at the end of the day. So, but it's created such an efficiency that our clinical team is able to manage that population as well as those that are on the program.
Right.
And Joe, I think just to give your team a lot of credit, I think, and to your point earlier, I think what we found as well is that technology is the tool, but the quality of the implementation and the investment from the frontline staff and how they use the tool makes all the world of a difference on the level of engagement from patients and the outcomes that you've mentioned. So, I mean, Cheryl Krasafi, Dr. Engelman, and the whole team at Baystate has done a tremendous job taking advantage of the platform and really educating patients and getting the most out of it. So, you know, the fact that they actually use the alerts and the dashboards and they monitor patients to, you know, prevent a readmission, that's their team doing it, not the Seamless team doing it. So kudos to your team for actually putting in the effort to actually get the most out of it.
Well, they're great. And Cheryl is absolutely an ambassador. When I first started at TechSpring, she heard that I joined and part of the patient engagement kind of strategy, if you will. And she came to my office one day and she said, do me a favor, don't ever lose this, right? And she showed me the MD. I'm like, oh, that's the first time I heard about SeamlessMD, quite honestly. I'm like, oh my goodness, what is this, right? So then she shared the results, and I talked to Dan, I talked to others. I'm like, why aren't we doing more of this stuff, right? So it's been a journey, but yeah, they've done great work there, to your point, Josh, and it's a fabulous team. So,
well,
sure.
Unrelated note, Joe, I guess you had your own, I guess, personal encounter. I remember you telling us about a veteran you met, I think at a mall, who had his own experience using Seamless. I love that story. Do you mind kind of sharing?
Yeah,
that?
Absolutely. Just an inspiring day. You know, this is one of those things that you asked a question earlier, or Alan did, about you know, kind of what inspires you to kind of on the digital strategy. And it's stories like this. So I go to the mall because I have to fix my iPhone crack screen, right? So I go during lunchtime, and we're just walking down, and this gentleman had a veteran's hat on. I always stop and say thank you for your service and have a little conversation. And he had to be about 86, maybe 87 years old. And in this conversation, he said, young man, what do you do? And I said, well, I work at Baystate, and I lead the digital health and digital apps and just kind of general conversation. Oh, like this one I have on my phone. I just had surgery and the doctor gave me this thing. I looked at it, SeamlessMD. I said, well, tell me about it in your own words. He's like, oh, it's great. He gives my whole journey, my plan. And his wife is sitting next to me. She goes, I have my version too. And I'm like, this is just awesome. So I asked him, I said, what's your experience like? And they were thrilled with it. They were thrilled with the clinical service. They were thrilled to be able to stay in contact with the clinical team, and his wife was really, you know, thrilled to make sure that he was following his plan as was laid out. So, so I brought that story immediately back to our leadership team, and it was on a Friday huddle. We meet every Friday, maybe about 200 or so, you know, leaders across Baystate, and I shared that story with the entire health system, because that's what digital health is. If you're able to engage your consumers and engage them in such a way to have a better experience and better outcomes, and feel like they're supported throughout their journey of health, that's a big win, big win. So, but of course,
Joe, I appreciate you sharing that. It reminds me of, like, I almost never wish someone has to use Seamless, because it means that they have to go through a serious healthcare journey. But if you're going to have to go through it, and I actually hope you do get Seamless. And as the company has grown, even ourselves, more of these stories start happening to our personal networks. I remember I had a former colleague who sent me a text saying, I think it was his aunt or someone who had to get surgery recently somewhere and then got Seamless. Or I actually had a colleague from high school who messaged me on LinkedIn a couple of years ago saying, hey, I got this Seamless thing. I needed my appendix taken out. Is this what you're doing? And so it's incredible to see the impact it's having on a personal level. So thank you for sharing that.
Yeah, absolutely. And another story is at a family reunion. I didn't share this one with you yet, Josh. This goes back to July. And my wife's cousin, who lives in South Carolina, his wife is a nurse at a very large clinic that does, you know, colon cancer screenings and things of that nature. And we're just talking about healthcare in general, and we're talking about digital health in general. I mentioned the Seamless story. She's like, what do they do? Where are they from? So you may have gotten a call from her along the way, because she's like, that's what we need. She's like, we get bombarded with phone calls and people concerned, and she called it the worried well. No, you're okay, you're fine, you know, but just having that connection. So so it's highly valuable across the board, and the outcomes have just been wonderful. So yeah, amazing. I think you publish those on your website, or you have those somewhere, but yeah, I would, you know, our team stands by those outcomes completely.
Yeah, your team did a fantastic analysis on the outcomes. I think in the cardiac program, readmission reductions of 72%, length of stay down by 0.9 days, NIF discharge reduction by 60%, and phenomenal outcomes, but great team behind it. Absolutely. I did want to get back to TechSpring. So Seamless was actually really fortunate to have benefited from partnering with TechSprings at Baystate. And so your team shepherded our Cerner SMART and FHIR integration at the hospital. just for maybe other companies or EHR vendors out there who want to understand how TechSpring has accelerated that process. How would you describe TechSpring's role in kind of making that process smoother and faster with a group like ours?
Yeah, no, it's a great question. It's a convener of great technologies that drive a solution, because one of the things that I discovered is that a lot of folks in the INT side did not understand a lot about SeamlessMD at the first part of the conversation. But when I started pushing the results forward, saying we need to do some scalability here and think about the integration to make it easier for our end users to get, to access and for their workflow, became a higher priority once they were seeing the results. So that's kind of what TechSpring's role is in that, is to say, okay, here's a great solution. How do we put into our overall framework and have those conversations? And Cerner has been a fantastic partner for us from an innovation perspective, and just integration, SMART on FHIR, all those bells and whistles, and to be able to then launch it for our end users and see their satisfaction increase. Because one of our collective goals at Baystate is to become a workplace of choice. So if you look at the INT side, how do you help achieve that goal? Is to take friction out of access to technologies and applications and make it embedded within their workflow. So it became a win-win-win-win-win. And then as you look at different service lines and programs, the first question always comes up, well, does this integrate to our workflow? Yes, it does. We're already doing it, right? So now it's just a matter of plug and play and go from there, build out the protocols, that particular service line, and move forward. So I call it a convener, and kind of threading the needle on that. But yeah.
I love that. And Joe, I'm curious, when you talked about, I actually thought it was a really unique perspective on the importance of making Baystate kind of an attractive place to work for your staff. And I'm guessing like COVID definitely didn't help with, retention, all these. I'm sure every hospital is facing these challenges with satisfaction right now, given a lot of the overwork during COVID. I was curious, like, are there regular staff surveys, or how do you end up measuring that sort of staff satisfaction or concerns with, IT workflows and all that?
Yeah, there's generally, the annual kind of employee satisfaction surveys is a piece of the INT side, and we look at that on an annual basis. But whenever we're delivering on the TechSpring side, whenever we're delivering a program, we always have a satisfaction. I think it was like the NPS score kind of approach, right? Not only the patients, but also the team members who are leveraging that technology. And we get great feedback on both sides of the equation. And another particular program that would help patients on the inside part as an inpatient and the nurses on the floor, we deployed that maybe about 10 months ago and a few units. And the feedback helped us inform the team that we needed to adjust our educational model because it was missing a few key points. Make those adjustments, then optimize your education program, and then relaunch, and then that satisfaction goes up. The patient satisfaction was through the roof in that particular program. It's 4.8 out of a 5-point scale, and the nurses were roughly around 3.5, but now that's up in the 4.5 range. Wow. So it's like that stuff you have to be informed about that as you're deploying or as you optimize your deployment. And then generally, then you look at all the other systems that have been out there for a number of years, the core EMR, and how do I get access to the technology and those types of reviews. One thing that has impacted us as an INT team because of COVID was our rounding. So pre-COVID, we would have a team that rounds on every clinical floor, every unit, and be able to get feedback directly from the nurses every shift. And that gave us real-time data to then go make improvements. But because of COVID, we're kind of off the unit, trying to do it virtually, and it hasn't been as informative. It's been helpful, but not as informative. So we're fingers crossed we can get back up on the units pretty soon, and then move forward. So, but we're still having a little COVID uptick here in Western Mass.
Has kind of the prioritization of COVID dramatically impact, I guess, the speed at which the innovation center is able to move? Like, have you had to, I guess, maybe put certain projects on hold, or how are you navigating staying innovative while still focusing on COVID, I guess?
Yeah, it's actually unlocked some opportunity, which is good, right? So certainly, we didn't have a big role in the virtual space as far as telehealth and that strategy, but remote patient monitoring certainly picked up a bit. And OB specifically, where we had a pretty significant concern about moms with risk of pre-eclampsia. And so we put an RPM program in that, limited number of patients, but the success of that is scaling. And these stories, like if you look at SeamlessMD and this other program we're working on, I hold those programs up to go, yes, we can do this at Baystate. Yes, here are some results at Baystate. It's a matter of now leveraging these in different service lines to then scale it out and go from there. Because we look at our quality goals and value-based care contracts, we want to get ahead of our hypertension population. We want to get ahead of our population with a very big concern within our region for mental health. And certainly chronic diseases such as diabetes. So the learnings that we've had from our partners to date tells us that we can move in that direction, and our consumers will leverage the technology to do so. So that's also very helpful.
That's fantastic. I think tying in, value-based care, like you mentioned, there's this old adage by Peter Drucker: what gets measured gets managed. Yep. And decision-making in healthcare is critical to improving patient outcomes. Patient-reported outcomes are becoming more and more valuable with value-based care, for instance. Could you share your thoughts on why collecting patient-reported outcomes data from across the surgical journey is important, and how patient-facing technologies like SeamlessMD can really help with this process?
Yeah, it's all about the quality and the cost of care, right? So we're trying to take that balloon and kind of squish it down as best as we can to balance out those variables, right? So any readmission that we can prevent is a significant cost savings to the payer and to us. And we have a very high Medicare, Medicaid population. It's about 70+% of our business. So that government payer side, we have those parameters and those restrictions. So it's very important for us to reduce the cost of care and deliver a higher value of quality of care. So any type of SNF reduction, any type of readmission reduction always becomes a good thing. We also have a very critical capacity management issue that the organization's always working on, because our main hospital is always 99% full, right? So any way we can reduce the length of stay to then serve more patients always becomes a very positive thing along that particular journey. So it all comes together, right? So how do we, and to your point about that quote, what is our baseline today and what are we improving on? And then measure that improvement to then say, okay, how do we now add more services? Because every time we add, and you guys know this, every time we add digital health or some technology, there's a cost to it, right? So what is that ROI? And that ROI could be hard dollar. So that's one reason to certainly measure, or it could be soft dollar, meaning that there's really not a dollar coming back, but the patients have a different experience, which gives us a different experience score, which then helps us long-term to become those centers of excellence and bring more consumers into those service lines. So, it also tells a story. Oh, that goes to one of the things we just did recently as TechSpring is that we are now doing an innovation prospectus on a quarterly basis. And think of that as an investor report, right? So we're actually sending that to our executive leadership and our board of directors to say, here's the innovation that's happened within Baystate. So here are the stories, here's where your investment's coming from, and here's where the measurable outcome is. And then you hear from others going, how do we do more? How do we help you scale this? And our foundation has reached out and saying how our foundation members are interested in making donations into these types of programs. So I'll carry that bag around and knock on the health story for sure.
That's awesome.
And go from there. Yeah.
By the way, Joe, I just want to say I think that's a brilliant idea, and it reminds me of as a company we send out monthly updates to our investors, and so frequently I'll hear from investors how thrilled they are, because for a lot of them, their companies other companies they invested in, they may hear from them at best once a quarter, maybe once a year. And so the fact that you're sending these quarterly updates to your stakeholders probably isn't that common in the innovation space. Like I bet you most innovation centers are not saying this once a quarter, but then the fact that you do that means that at least once a quarter, TechSpring is top of mind. It's going to jog some idea. It's going to get people, reaching out to you again. So I love that you're doing it. I'm going to guess it doesn't really happen that often in healthcare.
No, it's a brainchild of our senior vice president, CIO, and co-founder of TechSpring, Joel Venko. So as he's seeing reports come in from, some partnerships that we have, it was just his wisdom that says, why aren't we doing this internally? We have so many stories to share. And so Joel, myself, and Christian got to go, looked at some kind of ideas and structured it. And we sent the first one, actually the second quarter of this year was our first edition. And the results and the feedback was tremendous. We're like, okay, we're going to put this on a cycle and let's go forward. So,
yeah. Love it.
Yep.
That is pretty awesome. So we've talked a little bit about this, Joe, but when COVID first hit, Baystate Health was very quick to adopt virtual technologies. You were suggesting, even with rounding, all of a sudden virtual rounding was a thing. Now that the US is starting to open up a little bit more following the pandemic, what aspects of patient communication do you think virtual is completely replaced, and what do you think might go back to face-to-face?
Yeah, it's a great question. It's going to be a good balance of it. We're having these internal conversations today, nowadays at Baystate, because we don't know what the answer is truly going to be. So we're testing some experiments of how to engage consumers. Right now, one of our limited components is that we don't have a customer relationship management database or CRM. We'll have one by next spring. So we don't know what the preferences are of our consumers today. So we're testing out some little experiments of change, meaning that if you have hypertension, do you just want to receive a text check-in, or do you need more of the person calling you saying, "Hi, I'm a nurse and I see your blood pressures are doing this"? What level of engagement? Because there's a certain cost to each one. But I do believe that consumers will engage and have a good balance of engaging during the continuous journey between visits, and come to their visit for their annual wellness visit check, or if they're coming in every 90 days because they're diabetic, to be more of a, and stealing a line from Dr. John Moore, I used to work with, an apprentice in their care, knowing more about their care outcomes and the cause-effect relationships between things that are happening in their real world every day. A great example of this is, again, back to the OB program real quick. A patient came in and they were looking at their hypertension and just what's recorded in the EMR based upon the visits. And the patient's saying, "I'm feeling fine." But the doctor looked at the continuous hypertension scores. "Well, wait a minute, you actually had some concerns here. And let's have a conversation." It changes the dynamics of that care conversation. And when patients have that, then I think their engagement will sustain and increase by telling their friends, kind of word of mouth, if you will.
Mm-hmm.
We've had another program in pulmonology for asthma, very small pilot, maybe 30 patients, but the engagement rate was pretty high, and the average age of the patient was over 65. That was on that program. So people will say, "Well, the seniors don't want to engage on it."
Right.
Well, no, they do.
You have the data.
If they're introduced to it correctly, and back to that veteran I mentioned, it was 86, 87 years old. So I think it's going to be a balance between the two, but also give consumers a choice, right? And figure that out. There's another model, I want to say it was UPenn, for virtual care, that everything is virtual in this primary care clinic until you need a doctor. And then they have these locations where that virtual care doctor, we already have the relationship, meets you face to face to talk about that issue. That's brilliant. Mm-hmm. How do you do that and scale it? I don't know, but that's brilliant, because that's one barrier some consumers will say, "I don't want to lose that relationship with my provider."
Right.
So, but I think there'll be a balance along the way. It's not gonna fade out at all. I think it's a new model of care. And when you look at what's happening in the digital space, and the Walmarts and the Amazons and the CVSs and this, it's all becoming competitive.
Joey, you raised a really great point. Traditionally the idea was, you have that connection with that one main provider, that one main physician. But I think what you're getting to is that there may be an evolution happening where it's really more of a team-based approach, where it's like, maybe I don't want 100 different people in my circle of care, but if it's this group of 5 at Baystate who they all know my story, I interact with all of them in different ways. It's okay if I can't see, Dr. Diver, but I'm seeing someone else on Dr. Diver's team that I know and I trust. That may work just as well. I mean, even at Seamless, right? It can't always be the same person talking to Baystate, but as long as it's someone in the core team with Baystate that that you trust, you've worked with, it's going to be a positive experience for your side as well as our side. So I wonder if that's going to happen more often now.
I think it will, just for scalability purposes.
Yeah.
And you take programs like Seamless, and you can have the image of the physician and communication that says, "Okay, it looks like it's coming from Dr. Dan Engelman." In the background, Dan's going, "Yeah, I need to do this," but then the system is sending out the messages, and the patient feels connected. It's a beautiful, it's a beautiful experience. And how do we do that more and scale that? And I think you're absolutely right, Josh. There's going to be a lot of team-based approach at the end of the day, for sure.
Yeah. It's funny, my mind instantly went to Star Trek, and I'm thinking like holograms. You'll have a hologram of the doctor. That's the finally in person, but they're not there. Anyways,
yeah.
Joe, I'm wondering, kind of in line with what you were saying, how, it's a little unpredictable. There's going to be a lot of changes. There's a lot of big competitors coming out, different innovations happening. Do you have any major predictions for how virtual care could evolve over the next like 3 to 5 years?
Yes, I think there's going to be a lot of, call them touches and nudges, right? So, how does a system connect with a consumer? And let's say you're going to check in with me because of my sugar level, right? I'm going to report my sugar level. AI behind that will send me some personalized information back. That a boy, or hey, go out and get some, make sure you get your steps in today, or whatever the case might be. I think there's going to be a lot of that, making that connection happen. Interestingly enough, pre-COVID, one of those TechSpring events, we're talking about digital health, and we had an audience, maybe about 135. And I asked the question, I said, who do you trust? Do you trust Amazon? Do you trust Google? Oh, no. Do you trust, Microsoft? No. Do you trust your local health system? Every hand went up. Mm. So it's like, okay, now how do you as a health system take your business model and change it to this non-fee for service model and invest in these technologies to create that virtual space, which is also going to help you create capacity internally in your four walls to serve more patients in the population. Because one of the biggest issues in the US health market right now is access. Mm. So I think that's going to be a driving force for the next 2 to 3 years. How do you deliver virtual care in such a way that makes sense in order to create more capacity, but without building new brick and mortar locations, right? Yeah. Or for your average health system. It's going to be interesting to see what the payers are doing, and interesting to see, what's happening in the retail clinical space. Just breaking news this morning, you guys probably saw it. Current Health was acquired by Best Buy, and they're a UK system. There's a lot of these acquisitions happening. But what does Best Buy really need to do within retail healthcare? It doesn't kind of go to the top of my mind, right? Mm-hmm. But something's brewing. And what's going on with Walmart with their clinics, it becomes more of a competitive thing. But it's gonna be an interesting journey. But I do see the next 3 years really kind of smoothing out that landscape a bit.
So Joe, it's funny. I think a couple of years ago, people in the tech space would say, "Well, every company is becoming a software company." Now, I guess you could say every company is becoming a healthcare company.
That's right. Exactly.
I wouldn't have guessed Best Buy. I don't know about you, Joe, but I would never have guessed Best Buy on that one.
They'll at least upgrade the TVs in the patient rooms. So that's
actually we're doing that. It's a hotel experience now. You get
exactly.
One of our issues was that this is actually a true story. We deployed a particular vendor in the inpatient space for new experience and Hollywood movies. And they were trying to discharge this pediatric patient, and he didn't want to leave the room because he was watching this movie. He had another hour to go. That causes another problem in healthcare, right? Yeah. But anyways, the patient experience is great there. But I do see this trend of leveraging more digital health, very tied to what the needs are of the community. A lot more within the mental health space, and certainly any journey that we can deliver that reduces the cost and improves the quality, not only helps us from a value-based care market, but then when we go to payers and for our Health New England side, and employers to say you have a lower cost of care here in Western, we call it the drive-by, because people drive by Western, they drive by Springfield to go to Boston, but it's actually lower cost and better quality care in Springfield.
Right.
So how do you now begin to educate consumers of that fact, right? So, and you can't unless you get that engagement going. So,
right. Yeah, fair point.
I guess the nice thing about more and more services going virtual, Joe, is that it's easier for you to connect with patients who may not live that close to Springfield. It opens up that market for you in many ways.
That's right. Absolutely right. And then, that's right, because then we can eat at the margins of the other areas, and that's part of our growth strategy. And we now have a digital first strategy at Baystate. We've had some new executive leadership come in with new ideas, and our executive leadership team has been extremely strong over many, many, many years. But now it's a major investment in this kind of digital first strategy. So
Yeah, and I guess like in the past, access was table stakes, and now, or sorry, now it's table stakes, and now things like quality, like you mentioned, outcomes matter. If I can get care anywhere, then I want to go to Baystate where my care is gonna be better. I
That's
don't
right.
have to go local anymore.
That's right. Exactly. Yep.
Amazing.
Yeah. So a final question that we have, Joe, and it actually fits really nicely with the point that you just made, but if you could give advice to other healthcare IT or digital or innovation leaders in healthcare regarding adopting a digital patient engagement strategy, or really this overall kind of tech strategy as you move into the future, what would your advice be?
The one piece of advice I have, and this has been quite successful for us, is don't get so wrapped up in the big INT strategy with your EMR vendor. Don't be afraid to experiment, and don't be afraid to lean in with that experimentation, because that experiment may tell you that you have these great outcomes and you can do more, or it could mean that your organization is not ready for it. Too often we within health IT end up saying, well, how do I integrate this to my EMR? Before we even talk about the results and the outcome potential, it's like if we look at SeamlessMD. SeamlessMD came in through a purchase through the division of cardiovascular. It wasn't an INT kind of carry in. It came kind of in and around. But if it ever came in through the typical INT operation, it'll be 8 months of trying to assess when can we get the integration done, when we get this done, when we get that done, right? So don't be afraid to experiment outside of that engine, and then bring it back into the engine when you have the results and the outcomes. So I think that's one key component. And then, but for the innovator, and this is what I do, I always have my eyes on what our overall IT strategy is, so I know how it fits in, if it's successful, or how we move the ball forward. And then I can communicate to my colleagues on the inside of INT what we're doing on the innovation side, that it's not competitive, it's not creating friction, but it's innovating around the edges, and it's extending our strategy to a better direction, if you will. And not make a big bet investment until you really know you can knock it out of the park. And that's one thing that we really hold dear, is that, back to your measurement question, our goals are directly directly aligned with Baystate to say, how do we move the needle and change every year? We don't put a 3-year, 5-year strategy plan out. Every year we're making some sort of change that we can learn, that we can improve, and we can move the ball forward. That's informing the broader strategy, which is quite interesting. So,
yeah, this is amazing to hear that, because it sounds like such a nimble organization that has this culture of innovation, really fosters that, but it is such a still a large organization that's behind it. So that's really fantastic. That's the end of our main questions, unless Josh, if you had another one that popped up. I know Josh is always no, okay. We're good. So at this point, Joe, we're going to jump over to what we call the Fast 5 lightning round. It's essentially 5 quick questions just to get to know you a little bit better for our audience. All right, so the first question that we have is, what is your favorite book or book you've gifted the most?
Well, my favorite book is really my most recent, because it's quite helpful. It's become a kind of a book club on the INT side. It's Competing Against Luck. I was just introduced to this a few weeks ago, and I've absolutely enjoyed it. And it's it's Clayton Christensen, and it's how can you move innovation from this game of luck to really drive it forward, and picking up a few different pointers along the way. Some of the things validate the process that we're using, and then drive it forward. So I'll give you guys a good book report after I get through that. But so far, that's the most recent one. So now my dog is chewing at me. So
all right, we'll move on to the question 2. How has an apparent failure set you up for greater success?
Great question. It's not a failure of, and I should have my Kleenex with me on this one. It's not a failure as an INT leader. It's a failure. It's feeling like a failure as a dad. My daughter was in the NICU for 3.5 months, and I was a CIO at a major health system in Western Mass, but she was delivered in Boston, and she was transferred between hospitals 6 times, and I couldn't keep track of her medical record. How do we figure that out differently along the way? So it really caused a lot of stress and a lot of frustration on my part. And I thought I could do better if I could track her record and track her, I'm not a clinician, but just understanding and knowing. That's one. And then another one from an INT perspective, this goes back a number of years ago, is as a young CIO, I had a neurosurgeon come to me who was complaining about their systems. Basically, monitors were shutting down and things during a surgery, and well, that's a problem. And one of my technicians suggested to him, well, just put a mouse in your pocket and jiggle it every now and then, and go from there. And I took that issue away from that particular tech and gave it to somebody else. I said, that's not the right solution. And I stepped in the middle of my team and directed them pretty firmly to go solve this problem without giving the time or space to think about it as a group. And so that's also a learning, is that I will step away as a leader and let the group kind of digest what the problems are and figure it out, and then come back and let's have a conversation. But give them that space to develop, to innovate, possibly fail forward, whatever the case might be. So that's helped me on the INT side. But certainly that experience with my daughter just puts me in the shoes of a patient, loved one. It's okay, it has to be better, it has to be different. And how do we fix this? So that's one of my stories that drives me. So, yeah.
Wow, those are both fantastic. It sounds like a lot of personal stories is kind of what's helped you in healthcare and really innovation. And then obviously your other story was obviously super impactful. That's a great leadership skill that you've picked up. All right, third question. Would you rather have super strength, super speed, or the ability to read people's minds?
That's a great one. All the above. No, really to read people's minds. And the reason for that is if I had super strength or super speed and I didn't understand that problem that they were trying to articulate, it wouldn't mean anything, right? Mm-hmm. So if I can read their mind, then I can understand where they're trying to get to, right? And I think that would be my answer there. And because so often, more often than not, somebody has a problem to solve, and we talk for a few minutes, and we go to a whiteboard and we start like designing something or drawing it out, this, then that. Okay, because it's such a complex issue. But if we get right in there, that would be so helpful. And then figure it out. And I could read minds of investors and where they're going to make them bets and make the same bets. Right? So,
that's a good point. Yeah. That's good. Okay. Question 4. What is something in healthcare you believe that others might find insane?
Healthcare, just generally. I think, with the just general disconnects in complex healthcare organizations, healthcare systems, how things get lost sometimes, and how to recover. So I think it's a lot of healthcare is just so disjointed. I think people are beginning to learn that with stories that are coming out nowadays. But one would have assumed that my primary care doctor is talking to the specialist and they're getting the information that they need, even if it's coming from 2 different organizations, and it just doesn't happen, right? So, for patients or consumers that may listen to this podcast, it's how do you become more of a engaged apprentice in your care and understand it, so you can then really clearly articulate to your doctor, because you have 15 minutes to do so in your typical PCP visit, right? So, and then how do we leverage digital health to help close that gap? But those are it's disjointed, as I think is the summary of healthcare in general. So,
Joe, to your point, like I remember back when I was working in the inpatient environment, and then you realize how insane it is. Like, these are really sick patients with complex situations, and there's so many challenges in this microsystem of hospital care. And so I think, to your point, just giving people the chance to spend a day in a hospital and shadow and walk around, I think people would realize, oh my gosh, like this is a really complex environment.
Exactly. And I've had the privilege to work in Canada a little bit with another vendor, and learn a little bit about the Canadian space and the U.S. space. And it's the same thing for the doctors. They're all trying to take care of patients. Sorry for the dog. Complex conditions and things of that nature. So, if I could do it all over again, I'd go back to school and go to medical school and come back and be a doc. But
and then go to digital anyways, probably, right?
Yeah. Exactly. because you get it, Josh, you get it, right?
Yeah.
So and that's the beauty of it. When you get physicians that are on the digital side, they get the whole story and how disjointed it is, and go from there. But yeah, it's crazy.
Oh, that's great. Last question that we have, Joe, this is a COVID-19 kind of lockdown related question. What is one hobby or activity you've gotten into since the beginning of the pandemic?
Like 1.5 million other people, we got a puppy, so it's walking the dog.
There you go.
So that's right now. Yeah. So yeah, that's really the hobby for me. We unfortunately lost our dog, 15 years old, and so we got now a rescue dog from Georgia. But it's really just taking into account how you sitting all day because you're working remotely. You're not typically walking around all day, so just more health conscious, and be able to take those breaks and go do what you need to do for yourself. And the golf game's improved a little bit, not much, but it's improved a little bit. So when you guys are ready, so yeah. But that's really it for me.
That's awesome. And there she is making a guest appearance.
Yeah.
I love that.
That's awesome. Well, Joe, that's all the questions that we had today, and it's come up to the hour, but do want to thank you for coming on the podcast and sharing really all of your insights that you have from the digital space and how you're really tackling innovation at Baystate Health through TechSpring and all the innovation that you inspire, how you lead the team. A lot of insights in this podcast, a lot of wisdom shared. I definitely hope that we can get a ton of listeners on this episode, because there was a lot that I learned, and I'm certain that there's a lot for our audience as well. So thank you so much.
Yeah, absolutely. Appreciate the time and the invite to do so. And as we talk about things that have inspired me, one again is SeamlessMD. When I learned about Seamless, I met Josh and the team, and we met in person and had these discussions, and seeing the outcomes, you're just like, okay, it's on the right track. We can make a difference in healthcare together. And it's just great partnerships across the board. So again, thank you both for the invitation to do this, and look forward to seeing the podcast, and good luck with Cheryl's podcast. She'll be a great addition to it. So.
Well, now she has to come on.
She does. I'm going to text her after this. Yep. Absolutely.
Thanks so much, Joe.
All right, guys. Take care. Bye.
Thank you, Joe. Have a good one.